And let me introduce Dr. Dr. Kathrani. Thank you so much, Artie, to being with us live from the UK. I know you're here somewhere in the cloud. Artie is a clinician scientist at the Royal Veterinary College and a board-certified in internal medicine with a strong focus on nutrition and gastrointestinal disease. Please welcome Artie with me, and thank you so much, Artie, to be with us.
Thank you so much for the introduction. I hope you can all hear me okay.
Yes, very good.
Thank you. I apologize that I can't be there in person, and I hope that this acts as an adequate substitute, but I hope you feel me in the room during the presentation. So thank you again for inviting me. So what I'm going to talk about is nutritional strategies and gut diseases in dogs. So we can move over to the next slide. Thank you. So as an overview for this presentation, I'm firstly going to talk a little bit of background into inflammatory bowel disease, chronic enteropathy. And what I want to do with that background is really just set the scene for how nutrition can act as a trigger, not just as a therapeutic intervention. And then we'll talk about food responsive enteropathy, which is kind of like an umbrella term. There's lots of different diseases that fall into this category. So adverse reaction to food, inflammatory bowel disease, or chronic enteropathy. And we'll talk about what distinguishes adverse reaction to food from chronic enteropathy, and then look at some dietary strategies for both of those conditions. And then finally, we'll end with the pathomechanisms of these beneficial dietary strategies and the studies that have been done, particularly around chronic enteropathy in dogs. Next slide, thank you. So to start off with the background, So this is just a schematic, and you've seen this before in the previous presentations, but this is just breaking it down a little bit further. So the way I think about the pathogenesis of inflammatory bowel disease or chronic enteropathy is I think about this genetic susceptibility, whether it's a few or several, coming together with an environmental trigger. And then those two things in collaboration is what brings about that dysregulated immune response, or that intestinal dysbiosis that we see, and then that leads to that triggers the inflammation and inflammatory bowel disease. If you could just, tap, yes. The environmental triggers are really important, a really important part of that puzzle, and I think it's probably the one that there's a lot of focus on currently. And nutrition is really important in terms of that environmental trigger. And so particularly dietary risk factors in inflammatory bowel disease, which is really at its infancy in canine and feline chronic enteropathy. So in terms of in human inflammatory bowel disease, we know that environmental factors are important. So there's been a lot of migrant studies where they've shown people that are emigrating from countries that have low prevalence of inflammatory bowel disease, moving to countries with higher prevalence, they and their first generation children are developing inflammatory bowel disease at the same frequency as that country. So it kind of suggests there's something definitely in the environment that's predisposing them to developing that. And then in terms of nutrition specifically and how this can act as a risk factor, we've heard in a couple of the other presentations before this one how the westernized diet can influence that. So there's been a systematic review. There's been several studies in human inflammatory bowel disease, particularly the pre-IBD diagnosis, showing that increased dietary fat and animal protein and decreased dietary fiber and fruit can act as those kind of triggers or those risk factors to the development of inflammatory bowel disease. And then there's other nutritional factors which have kind of shown inconsistent results. So omega-3 fatty acids in some studies have shown to be protective, in others not so much. So it's not always easy to do these studies, but there are definitely some nutritional factors that are acting as risk factors. So we tried to mimic this in canine inflammatory bowel disease or chronic enteropathy. We wanted to look to see if there were similar pre-illness dietary risk factors in dogs with chronic enteropathy. So this is a study we published a couple of years ago, where we had 48 dogs with chronic enteropathy and 47 without gastrointestinal disease. And we did a retrospective case-controlled questionnaire-based study where we interviewed the owners, and we asked them for really extensive diet histories prior to their dog developing gastrointestinal signs. And what we found when we compared these two populations is that the frequency of the main diet containing no carbohydrate was greater for the control dogs versus the chronic enteropathy dogs. And then fewer dogs with confirmed chronic enteropathy were fed a main diet containing red meat as the primary protein source versus controls. And that's the opposite to what we see in humans with inflammatory bowel disease, where red meat tends to be a trigger. And then finally, we showed a main diet moisture percentage of less than or equal to 14% as fed was significantly associated with confirmed chronic enteropathy in logistic regression analysis. So these were interesting findings. I think they need to be confirmed in a larger cohort prospectively, ideally. And this is something we're kind of in the process of trying to do. But I think this just really nicely highlights that there may be also some pre-illness dietary risk factors that we need to be aware of in dogs and also in cats with chronic enteropathy. And so why I wanted to set the scene for this is whenever anyone asks me to talk about nutrition in chronic enteropathy, we always focus on nutrition as a therapeutic intervention, which absolutely we should do. But I think sometimes we forget that nutrition can sometimes act as a risk factor, and we need to look at that. And so I just wanted to show an example of this on this slide. So we had a dog come into us. This dog had chronic gastrointestinal signs for at least 3 weeks. We did our standard workup for chronic enteropathy, so blood work, fecal analysis, abdominal ultrasound. We didn't find an underlying cause, and so it seemed reasonable to change the diet to a therapeutic diet for chronic enteropathy. But before we did that, we asked the owner to fill in a diet history form. So she filled in the diet history form, we had a look at it, and that's what I presented on this slide, and we were really surprised to see how much of this dog's daily diet was made of treats. And so what we did is we asked the owner just to stop the treats. We didn't change the diet. We said just to stop the treats. She did that, and then she emailed us back. And then if we just click. Yeah, so she sent us an email saying, it's been a few weeks now. I've eliminated all chews and treats. So he's only eating the main diet. And thankfully, she's completely back to normal now with a soft stomach, no gas, normal eating habits, and regular energy levels. And this isn't the first time where this has happened, where we've asked owners for diet history and we've looked at all the different things they're feeding, and we've kind of identified that there could be maybe a trigger, and we've asked them to stop feeding that, and the gastrointestinal signs have gone into remission. So I think what I want to highlight here is it's really important to collect that diet history, to have a look and to try and identify that if there could be anything there that could be acting as a trigger for the chronic gastrointestinal signs, because just discontinuing that may be enough to get them into remission. However, saying that, this isn't the case for all dogs with chronic enteropathy. What I can't tell you is what proportion of dogs what proportion have a dietary risk factor, because not all of them do. Sometimes we'll stop the treats, or we'll stop what we think is causing the gastrointestinal signs, and that won't be enough for their signs to go into remission. So it seems that there is a small proportion of dogs where there is a dietary trigger and it's enough to remove that. But for some dogs, it's not enough, or there isn't a dietary trigger, and then we have to use nutrition as our therapeutic intervention. So for food-responsive enteropathy, these are those cases of chronic enteropathy that respond to diet alone, but this is a very heterogeneous group and represents lots of different diseases. So the three main conditions we talk about under this umbrella term is dietary hypersensitivity and dietary intolerance, which together we call adverse reaction to food. And then the final category is your inflammatory bowel disease or chronic enteropathy. Yeah, so those two we call adverse reaction to food. So we'll talk about adverse reaction to food now. So this is a schematic taken from human medicine. So this is gastrointestinal reaction to food and how they subcategorize their cases. So they subcategorize based on whether the adverse reaction to food is toxic or non-toxic. So example of a toxic cause would be something like aflatoxin that the patient's ingested with food, and that would be a toxic cause. And then the non-toxic causes are subcategorized either into immune-mediated or non-immune-mediated. So the non-immune mediated causes, examples here would be either enzymatic, so things like lactose intolerance, or pharmacologic. So for example, vasoactive amines in spoiled fish, that could cause an adverse reaction to food. And then your immune-mediated causes, again, these are separated into the innate immune system and then the adaptive immune system response. And it's really a lot of the adaptive immune response is what's been studied the most and what's most well known. And then we have the further breakdown of whether this is IgE mediated, so your classic type 1 hypersensitivity, or your non-IgE mediated type 4. And then, so if we think about three broad categories for a GI adverse reaction to food, you have your toxic causes. And then your non-toxic causes is what we refer to as dietary intolerance. And then your immune-mediated causes are your dietary hypersensitivity or your food allergy, where the immune system is implicated. So those are the three broad categories for gastrointestinal adverse reaction to food. So in human medicine, for gastrointestinal food hypersensitivity or food allergy, they have a really nice schematic where they have taken all the different diseases and categorized them either into IgE mediated, non-IgE mediated, or mixed IgE and non-IgE mediated. So in this slide, we're just going to look at examples of this kind of really nice categorization. So for the IgE mediated, they have immediate GI hypersensitivity or oral allergy syndrome. And then for the non-IgE mediated, you have your food protein-induced enteropathy, enterocolitis, proctitis, and celiac disease. And then in the middle, you have diseases which are both IgE and non-IgE mediated. So your allergic eosinophilic esophagitis or allergic eosinophilic gastritis. So this is a really nice way they've subcategorized the different causes of gastrointestinal food hypersensitivity in people. So in companion animals, unfortunately, we don't have anything as sophisticated as that, or we haven't categorized it in that way currently or at this time. Hopefully in the future that will change. But the way we look at gastrointestinal adverse reaction to food in companion animals is we still look at those three big categories. So either the animals ingested something toxic, or it's a dietary intolerance where it's non-immune mediated, but it's causing an intolerance, or there's an immune mediated component like a food allergy. And so these different causes of adverse reaction to food, in terms of how we diagnose them, this is where the diet history can really help us. So if we know that the owner's feeding a commercial diet that has grains, or there's been a recall on that diet for aflatoxin, or if they're feeding something that could elicit a non-toxic, non-immune mediated reaction, then the diet history would help us. For those food allergy, food hypersensitivity cases, those are sometimes very difficult to diagnose because we don't at this time have anything commercially available to us that is able to definitively diagnose that. So the IgE antibodies that are commercially available, skin pricks, patch testing, they're not sensitive or specific enough. So the gold standard to diagnose food allergy, food hypersensitivity is a food trial and then a challenge. A lot of owners won't challenge once the animal's gastrointestinal signs go into remission, so the diagnosis remains tentative for food allergy, food hypersensitivity, and then it becomes the biggest differential for that is, was this a chronic enteropathy or an inflammatory bowel disease that responded to diet? And so it's sometimes, again, difficult to tease these things apart. But why this is important, I guess, for future research to look and to try and tease apart a gastrointestinal adverse reaction to food and inflammatory bowel disease, chronic enteropathy, is because the dietary strategies are different. So if we have an animal that has a food allergy or a food intolerance, really our focus from a nutritional perspective is to avoid that allergen or that discriminated food. Whereas if we have a patient with inflammatory bowel disease or chronic enteropathy, we want to use additional dietary strategies beyond just avoiding or destroying that specific dietary allergen. We want to use different nutritional components or different nutrients to alter gene expression, to influence epigenetics, to influence the microbiota, to improve GI permeability, to regulate the immune system. And we know that there are dietary strategies. We know that there are certain nutrients which can help to impact these different mechanisms in the gastrointestinal tract. And that's what we want to do ideally with chronic enteropathy. So if you remember at the start, we saw how there is this dysregulated immune system, there's this dysbiosis, but what we want to do is use nutritional strategies to try and correct those. And that's kind of what we're aiming for with nutrition in chronic enteropathy. So what are some of these dietary strategies that we talked about that could help with those additional factors that we looked at in the previous slide? So the dietary strategies listed here, this is what we use. We manipulate all these different strategies to try and get that dog or cat into remission from their gastrointestinal signs. So we're using a highly digestible approach. We'll modulate the fat content. We'll use different fiber types and quantities. We might use limited ingredients. We might alter the consistency of the food. We might use novel hydrolyzed or elemental protein, or we might use ingredients which we know are immunomodulatory, like soy or omega-3 fatty acids. So we're using all these different strategies to try and offset the dysfunction that is in the gastrointestinal tract from that chronic enteropathy, to kind of regulate that. So the dietary strategies I've underlined, I'm going to look at in a little bit more detail to kind of go through some studies in companion animals where fat, fiber, and hydrolyzed approach have been shown to help with those functions we looked at in the previous slide, and why therefore they would be beneficial in chronic enteropathy. So let's start with the benefits of a low-fat diet. There's quite a few studies in human inflammatory bowel disease that show that high-fat diets can exacerbate gastrointestinal signs. And when we look at mouse models of inflammatory bowel disease, and we have to bear in mind that when we look at mouse models, it's these kind of findings have been shown they're looking at it in a specific genetically modified mouse model. So it may be that in one genetically susceptible mouse model, we see these findings, but we might not see it in another mouse model. But in one genetically susceptible mouse model, they showed that high-fat diets exacerbated colitis and caused enrichment of pro-inflammatory microbiota, and they also increased barrier dysfunction. So in this particular mouse model, when they fed increased saturated fats, that caused the production or the increased production of taurocolic acid, and that caused delivery of an increased amount of taurocolic acid into the colon, which induced a dysbiosis and caused an imbalance of bacteria that had more of a Th1 inflammatory profile, and that led to the colitis. So there is some evidence that feeding a high-fat diet can have some adverse effects on the microbiome and also on inflammation. And then similarly, there's been studies looking at high-fat diets. Again, it's in specific genetically susceptible mouse models of Crohn's disease, where they showed high-fat diets induced toll-like receptor expression. So toll-like receptors are important receptors for the innate immune system, and they showed that high-fat diets would cause upregulation of NOD2 and TLR5 mRNA. So it was having some effect on the immune system, if you like, as well. And TLR4 dimerization, so this is a toll-like receptor that recognizes lipopolysaccharides on gram-negative bacteria. When they dimerize, it causes their activation. So that dimerization was facilitated by saturated fatty acids. And then finally, again, the high-fat diets showed increased GI permeability by causing a dramatic decrease in occludin expression. So again, it's just showing you some of the negative effects that high-fat diets potentially could have in individuals that have that genetic susceptibility. And that's why we kind of infer that if the high-fat diets are doing that, then maybe the low-fat diets in those individuals might be more beneficial. So this was a study in dogs. This was in clinically healthy dogs where they looked at high-fat diets, and they wanted to determine the effects of a Western diet on inflammatory indices, microbiome, and fecal bile acids in dogs. and they had 10 adult clinically healthy dogs, and they fed westernized diet to these dogs, and they showed that it promoted colonic dysbiosis, altered fecal bile acid, and caused low-grade inflammation independent of obesity. So again, it's showing you in healthy dogs it can have some effects on the gastrointestinal tract. What needs to be done is to look at the effect of low-fat diets on the gastrointestinal tract, and do low-fat diets cause a kind of beneficial response beyond just neutralizing these effects? Do we see any more benefits? And I think those mechanistic studies need to be done in dogs with chronic enteropathy. Clinically, we know that low-fat diets can help dogs with enteropathy go into remission. There was an abstract presented at ECVIM a couple of years ago which showed they could be effective. So it's definitely a strategy that can help. In terms of the mechanisms, I think we need more research there to try and ascertain what's going on. But this strategy does remain as trial and error. And I think whether it's going to be beneficial or not is likely dependent on that individual's genetic susceptibility and the underlying pathophysiology of their chronic enteropathy, which can be so different dog to dog. So again, it's a reasonable approach, but it is one that requires trial and error. In terms of the benefits of fiber, there have been many studies looking at soluble fibers, or specifically fermentable fibers that are fermented in the colon to short-chain fatty acids. And these short-chain fatty acids can have numerous beneficial effects in the colon, so they can act as an energy source for the colonocytes. They can help to maintain epithelial integrity, decrease pro-inflammatory cytokines, decrease intestinal inflammation, and alter the microbiota. And insoluble fibers can help to improve bulk and transit time. And there's, again, a lot of clinical studies, well, not a lot, but some clinical studies in dogs and also in cats that high fiber diets can be beneficial, particularly in chronic enteropathy where there's predominantly or exclusively large intestinal signs. But I think, again, we need more studies to kind of look at all the different kind of pathomechanisms that go into that. And then finally is the hydrolyzed protein strategy. This is a really interesting strategy because historically, the reason we thought it could help is with hydrolyzed protein diets, the protein is hydrolyzed to a small size to try and prevent cross-linking of two mast cells on an IgE receptor. So essentially what it's trying to do is to prevent that cross-linking on the mast cell and prevent that mast cell from degranulating. So these are trying to avoid an IgE-mediated type 1 hypersensitivity. However, what is not known is what proportion of dogs and cats with adverse reaction to food with food allergy have a type 1 mediated hypersensitivity. So it's unclear if the reason hydrolyzed diets are helping is because of this mechanism, or it's likely something else, because we don't believe a lot of them have these IgE-mediated type 1 hypersensitivities. So there's probably other mechanisms at play in terms of why hydrolyzed diets are so effective at helping in chronic enteropathy. And then the non-IgE-mediated hypersensitivities, we don't know what size the protein needs to be to evade that. And again, we don't know what proportion of our canine or feline gastrointestinal food allergy have these mechanisms. However, saying that, I think hydrolyzed protein diets are effective at, if you like, dampening the immune system. I kind of don't know how to phrase it, but we did a study a few years ago now where we had dogs with chronic enteropathy that were visiting our hospital, and on the day of presentation with their gastrointestinal signs, we collected whole blood and we incubated it with sterilized diets that they were eating at the time. And then we incubated that for 24 hours, and then we measured different anti-inflammatory and pro-inflammatory cytokines in the supernatant. So we measured IL-10, which is an anti-inflammatory cytokine, and then TNF-alpha and IL-4. And what we showed, what you can see on this bar chart, on the x-axis is the type of diet the dog was eating. And you can see for the hydrolyzed diets, and you can see there were 6 dogs that were receiving hydrolyzed diets on the left, they had very minimal cytokine response to the diet compared to home-prepared diets and commercially intact diets. And we also replicated this finding in healthy cats, and that's also been published as well, that hydrolyzed diets don't seem to elicit a comparable cytokine response to some of the other types of commercial diets or home-prepared diets. So that kind of suggests that hydrolyzed diets are having a beneficial effect on the immune system. And we know that in chronic enteropathy, the mucosal immune system is dysregulated. So this could be one mechanism as to why they're helping. Other mechanisms for hydrolyzed protein diets is their effect in altering the microbial community structure and synthesis of secondary bile acids. This is a really nice study where they showed diet-induced remission in chronic enteropathy in dogs. They showed remission induced by that hydrolyzed protein diet was accompanied by alterations in the microbial structure. They show decreased abundance of pathobionts, so for example, E. coli and Clostridium perfringens, and reduced severity of dysbiosis and increased levels of secondary bile acids. And the physiological level of these bile acids inhibited the growth of E. coli, C. perfringens isolates, and the metagenomic analysis identified the bile acid producer Clostridium hyrinonis as increased after dietary therapy and a likely source of those secondary bile acids during remission. So this is a really nice study to really show us mechanistically what these hydrolyzed diets are doing and what impact they're having on the microbiome and also on secondary bile acids. So this is, again, another reason they're helping dogs with chronic enteropathy go into remission. And then finally, there was a nice study looking at structural and ultrastructural lesions at the intestinal mucosal level. And this study showed that dietary therapy with the hydrolyzed soy diet in dogs with chronic enteropathy improved the ultrastructural lesions of mitochondria and brush border. So again, this is another mechanism in terms of how hydrolyzed diets could be helping. They could be helping with healing at the border, and that can also help with attaining remission for these dogs. So that's everything from me. I'd be really happy to answer any questions. Thank you.
Is there an interest to try an increased protein diet in food-responsive enteropathy in some case?
To increase the amount of protein, you mean?
Yeah, that's a great question. So it's really interesting because we did a study in cats with chronic enteropathy where we fed them a hydrolyzed protein diet. And what was interesting, we compared metabolites between responders and non-responders, so dietary responders and dietary non-responders. And the non-responder cats, they had higher amounts of gut-derived uremic toxins that come from certain aromatic amino acids. When they escape digestion from the small intestine and go into the colon, they get fermented into these uremic toxins. So I think it's an interesting question. I think it kind of depends. If we feed too much protein and they're not able to digest or absorb that protein and it goes into the colon, it's kind of what effect is it going to have in the colon in terms of once it gets metabolized and what metabolites get produced and whether they're toxic or not toxic to the gut. So in theory, we think, oh yeah, feeding more protein is good, but it might not be depending on how that protein is digested, absorbed, and delivered to the colon.
Thank you, Ati. Is there another question from colleagues from the industry, for example? No question? Yes, one question there. There is one more, Ati, and then we can have lunch then.
Hi, thank you very much for your presentation. That was very clear. Is there any difference, because you talked about the digestibility of the food, do we know if there is a difference between industrial and homemade food for dogs?
Yeah, so generally we would consider homemade diets to be more digestible. I think it depends on the ingredients you're using and then the commercial product, but generally we say homemade is more digestible. in terms of the clinical impact and the impact mechanistically, I don't know how much of a difference that would make in terms of that difference in digestibility. Because sometimes for gastrointestinal disease, we'll pick a commercial therapeutic diet that has higher digestibility. The hydrolyzed proteins, because the protein source is broken down, you already think it's probably more digestible than the intact protein. So it is more digestible. So I think we don't, to my knowledge, have very good studies comparing the two in terms of the impact it then has on metabolites, microbiome, etc., in dogs or cats with chronic enteropathy. We know that home cooked diets can induce remission and can improve gastrointestinal signs, but whether one is superior to the other, I guess there's so many factors that go into that.
Okay. Okay, thank you very much, Arti. We can thank Arti with me, please.
Thank you.
Thank you for being with us.